One of the questions that we get a lot of is, what is the difference between a neurologist and a neurosurgeon? Really, we're two halves of the same orange. The neurologists like to say they're the smarter half of the orange and that we're the technician. But really, we work hand in hand with one another. We're both taking care of the nervous system. The nervous system means your brain, your spinal cord, and all the nerves that go out into your arms and legs. The difference is really centered on which types of conditions we manage. Neurosurgeons are trained in trauma, and we're trained to take care of degenerative problems that are treated surgically. The neurologists take care of medically managed problems. For example, the neurologists are much better at managing chronic headache syndromes than I am. Oftentimes, they're going to be at the very forefront of managing things like neck and back pain, if they can be managed simply and medically. Neurologists are far more experienced at diagnosing and managing diseases of the nervous system like Parkinson's disease, multiple sclerosis, other diseases that affect the brain that we can't treat surgically. They are going to be much more skilled at the diagnosis and treatment of things like dementia, an ever-growing problem in our aging population. The neurosurgeons manage trauma, brain injuries, concussion, and we're also called upon by our neurology colleagues to manage things like brain tumors that need surgery, need intervention or diagnosis in that regard. We manage structural problems of the spine, ruptured discs, lumbar stenosis, problems that involve pinched nerves. The neurologists may diagnose carpal tunnel syndrome or ulnar neuropathy because they are particularly good at doing the electrodiagnostic tests that tell us how those nerves are working. Nerve studies, that might be the term you're familiar with. Once that diagnosis is made, the treatment oftentimes is a surgical one, and we're referred many patients from our neurology colleagues for peripheral nerve problems.